Welcome back to the Aimmee Kodachian and the Experts Show, where we bring some of the top experts in the world to help you transform your business and personal life. And sometimes we bring some people with inspirational stories that helps you to see your life in a whole different perspective. I am your host, Aimmee Kodachian,
not Kardashian. And I'm your co-host, Stephanie Thompson. I'm a classically trained singer-songwriter. Well, in this episode, and this is the second segment of 4 segments, we've been learning all about oral health and how important it is to take care of your mouth with Chef Sharynne Frazer.
Wow, and we sure did. Thank you so much for your knowledge to share with us. Now,
you know, the funny thing is a lot of people try to make the correlation. They go, well, why is a chef talking about mouth and teeth?
Yeah.
Well, it's all related.
Sure.
How we eat, how it sets up our mouth, how the gums, everything.
Now, you mentioned something that you do have some medical experience.
Lots.
Could you tell us what you have?
Sure. Well, I'm going to be 70 in August, if that tells you. If that gives you any clue.
Yeah.
Let's see. A total of 35, about 38 years medical lab technician. Worked in blood bank, and then I worked in surgery as a surgical tech. So I've spent a lot of time laboratory work, studying the body.
Around doctors. And,
doctors, hospitals, morgues. And I'm still studying the body. I will always study the body because it intrigues me. It always has ever since I was little.
I
do. Because you know what? The body is amazing.
Yeah.
Even though we abuse it,
it's amazing.
if we feed it right, it'll come back.
Could you imagine? I mean, look at you. God bless you. 70, I can't believe that.
Oh, I have to share a tip.
Wow.
My hair, it used to be snow white.
Okay.
And if you'll notice now, folks, it's starting to get darker. I've been doing Ayurvedic copper water. Copper is one of the nutritional supplements that you need to bring
remember that.
color back in your hair.
Oh.
So my friend says, "Did you dye your hair?" I said, "No, why? It's getting dark." Thank you.
Wow. See, we've been given a lot naturally to really take care of ourselves, but we go away from that and we, take something else that doesn't work, and we want easy fix. That's what it is.
Right. And you know what? A lot of it is too, Aimmee, that I've learned over the years is that, unfortunately, as we grew up, we weren't given the tools about our body.
Yeah.
We don't have a clue how to take care of it, so we try this and we try that diet and this diet and cabbage diet and banana diet and this. We never learned what our body needs and how it functions.
And how it works for you.
Yes.
Each person works differently.
Yes.
So that's an interesting question. How old, how young do you need to start with all of this?
As far as children goes, as soon as you are ready to start brushing their teeth, whether it's with a finger toothbrush.
Okay.
Or whether some people start off with like a cloth with a little toothpaste and they start.
Okay.
On that note, if we can talk real quick.
Sure.
The company that I'm working with right now, that I work with and am partners with, is a company here in town called Vitamer. Okay. And I don't normally align myself. This is not a multi-level marketing product. This is a company that's been in business here in Las Vegas since 1999. They make 3 different types of toothpaste, but the one we'll talk about real quick, since you asked, is our children's toothpaste. Now, for moms and dads and caregivers that are listening or watching, take a look at the toothpaste tube and the warning label that's on it. It says, if your kid swallows this, please call 911. So why would you want to give your child that type of toothpaste?
Yeah.
Most adults don't even know that it's on the tube. So I'm here to tell you.
Because they don't read. It's sold in the store. We feel comfortable. It says for kids. I'm sure somebody's protecting those kids, but they're not.
And I saw it on TV.
Yeah, exactly. I saw it on TV with a kid.
And they would never put something out that could hurt my kids.
Right.
Right. Okay. So anyway, back to the toothpaste. So what we have for the children is all of the oral health care products that we have only have 5 ingredients, all of which that you can pronounce, like distilled water, zinc, clove oil, myrrh oil, and zinc. Okay, that's it.
Wow.
Nothing you can't pronounce. Every single one of them has a function. They
so
act
anything
as
you read you can't pronounce. Be careful.
Be a little
exactly.
hesitant.
This is great for kids because, first of all, it has xylitol, so you don't have to worry about the sweetening that's used. It's for no cavities. But it's also antibacterial and antimicrobial to control the bacteria count in children. All right?
Okay.
Yes, absolutely. So however young you start the little ones, if they're 18 months or so and, mom's taking a little gauze or something, and
Just starting, yeah.
start them, okay? Because the materials that are in here and the herbs that are in there are going to start helping remineralize, because that's one of the biggest problems that we all have because of our diet.
Okay.
Our teeth are not mineralized properly, so when you look at them under a microscope, they're very pitted. So they collect everything. Everything you eat sticks to your teeth. Everything.
Wow.
Everything.
We don't think about this stuff because we just, you think about it, you never eat.
Yeah,
You
exactly.
think about it so
Yeah.
deeply. I would never eat anything.
And you know
but
what's
we
funny?
have to.
And you know what's
To
funny? One of the
survive.
things, if people would, if you could get into a habit, and this was probably the hardest thing for me because all my life I thought I was doing the right thing and all I did was learn the wrong thing for many years. But if you can associate the fact with every single time you eat, those teeth must be brushed. Starts changing your eating habits, number one. However, if you cannot brush your teeth, what I would recommend is a mouthwash or something. You can excuse yourself from the table, even if it's a business meeting, when you're finished.
Okay.
Go to the restroom. Use either vitamin mouthwash or use water to at least dilute.
Okay.
Because remember, the minute that food hits saliva, digestion starts.
Sure.
Okay? And the biofilm and all the good bacteria are starting to break down your food as it starts going down. So at least rinse.
What you have.
Yes.
So you don't continue.
Exactly.
Take it,
Exactly.
okay.
Now, at night is the most important.
More than in the morning. I have
Most
yeah.
important, because what happens is the tongue, when your tongue relaxes, it goes up against the palate, which is the roof of the mouth.
Okay.
That's where all the bacteria grow. That's where the stinky breath comes from, because it's dark, it's wet, and it's in close proximity to the roof of your mouth because your tongue relaxes and it goes up. Okay?
That's true.
So when you wake up in the morning and you put that bad boy, you open your mouth, that's why that breath smells. Okay? Now, I've done some studies just on my own personally that I would like to share.
Sure.
Once you get that bacteria count under control, and we're going to talk real quick about tongue cleaning.
Yes.
Once you get that under control, I did a study on myself. I went for 3 days and did not brush my teeth on purpose
To
to
take
see
to see
if
what,
that bacteria smell would come back. It never did. But what did come back and is always there is the slime that you will take off of your tongue.
Oh,
Every
okay.
single time saliva comes in contact with anything, water, juice, food.
activates.
Totally. Totally.
That's the trick. It
So when you're
activates.
scraping, okay, it's a little horseshoe shape. I think I even brought one. Little
Okay.
horseshoe shape. And at first you're going to think, oh my God, it's disgusting. It is nasty. But let's just think of it this
But
way.
you don't want this nasty stuff to
That's
go inside
right.
of you.
You
either.
want it out. You want it
Right?
out. It's full of toxins. It's full of all kinds of stuff.
Okay.
So you want to scrape lightly.
Okay.
You'll hold it down the front, on the sides.
Okay.
Now, when you get better, you bring the two together so it's a tighter yellow. a tighter U, and you can go back further. But you'll grow into that. That way you
I'm
won't,
gonna
you won't
have
gag.
you on my in my academy for sure.
But that way
You're
you
gonna
won't
be one
gag.
of-
You won't
yeah.
gag, but you kind of build into it. But if you're using a toothbrush right now to do your tongue, please, it just don't waste your time. It's not going to work.
Okay, so when we come back, we're
Yes.
gonna be talking about that. We have 2 segments left, and we're gonna be talking more deeply. And I'm sure you'll give them your website or
Oh, sure.
anything. I know you have a show too. We could be talking about that. So if you are watching live right now, stay with us. And if you're not, go to akandtheexperts.com to watch all the segments that we previously recorded. We'll see you soon.